Protect Workers from COVID-19, July 2021 update. This short video is prepared by the Labor Occupational Health Program at UC Berkeley as a way to provide an update on some of the changes to the Cal OSHA standards. There are some changes to the employer requirements in the Cal OSHA COVID-19 Prevention Emergency Temporary Standards that went into effect in mid-June. In this video update, our goal is to describe highlights of these changes and what workers can expect. While our focus in this video is the Cal OSHA standard, we recognize that the context has been shifting in the past few weeks with the rise of the Delta variant. At the time of this recording, the Centers for Disease Control and Prevention, or CDC, has issued new recommendations, such as having everyone in substantial or high transmission areas wear masks indoors, and having vaccinated people be tested after exposure, even if they don't have symptoms. The California Department of Public Health is also recommending universal masking indoors statewide. And some counties, like Los Angeles County and the Bay Area counties, are now requiring masks indoors of everyone. Employers can go above and beyond the Cal OSHA standards requirements to implement protective measures as part of their own prevention plans at the worksite. Employers also need to watch what the California Department of Public Health recommends and follow updated state guidelines on masking and testing, as well as comply with any local requirements, such as those from the local county health department. In the past year, we have emphasized a combination of methods to help prevent the spread of COVID-19, and these have also been required by the Cal OSHA emergency standards that went into effect in November of 2020 and describe employers' responsibility to protect workers from COVID-19. The good news is that vaccines have become more widely available, and vaccination is one of the most important steps towards ending this pandemic. With more people vaccinated, there were changes made to the measures employers have to take to prevent COVID-19 transmission, in particular in the areas in gold: distancing or being 6 feet apart, face coverings, and disinfection. These changes went into effect on June 17th, and we will review them now. Some of the changes in the standards are going to depend on whether workers are fully vaccinated or are unvaccinated. Employers need to document workers' vaccination status and are allowed to ask about this status and to take a copy of the vaccination card or other records.
One of the changes in the Cal OSHA standard has to do with physical distancing at work. This, as well as physical partitions or barriers, are no longer required in most cases. If there are outbreaks, employers have to take extra steps. An outbreak is defined as 3 or more workers in an exposed group developing COVID within a 14-day period. Major outbreaks involve 20 workers or more in a period of 30 days. In major outbreaks, employers have to implement 6 feet of distancing by setting up the worksite or schedules to allow for this and or set up partitions or barriers. Otherwise, in outbreaks, they have to evaluate the need for distancing or barriers. Employers can still use physical distancing and barriers at any time if they determine that they are necessary or protective. There are some changes on the requirements for face coverings, largely based on workers' vaccination status. Face coverings are not required for workers who are fully vaccinated, or when workers are outdoors, or when a worker is alone in a room or vehicle eating or drinking. Face coverings are required for unvaccinated workers indoors or in vehicles, and for all workers during an outbreak. They're always required indoors, but also outdoors if workers are less than 6 feet apart from others. In addition, they're required by orders of the California Department of Public Health or a local health department. N95 respirators are most protective against tiny particles from the coronavirus. While face coverings primarily protect people around the user, N95s and other respirators protect the user from the airborne disease. Employers now have to provide these respirators to unvaccinated workers who request them. As part of this, employers also have to have replacements for any that become dirty or damaged, or after a typical workday, and provide training and instruction to workers on how to properly put them on and off and perform a seal check. Certified and approved N95 respirators have the words N95 and NIOSH on them. In the event of a major outbreak, employers have to offer N95 respirators to all workers, regardless of vaccination status. Workers need training on how to properly wear N95s, including the placement of the two straps that you see in the figure and adjusting the nose piece to fit the nose. They should also be trained on how to do a proper seal check, how the respirator will not seal around the face effectively when there is facial hair, and when to replace it.
Workers may have questions like, can I still wear a face covering even if I am vaccinated? Although it is not required by the OSHA standard, you are still able to do so if you want to wear a face covering. Your employer cannot retaliate against you in any way for asking to wear a face covering and must provide one upon request. Also, remember that a health department order may require even vaccinated workers to wear face coverings.
An unvaccinated worker may also ask, if I don't want to wear an N95, can I wear a face covering instead? And the answer is yes, though remember that N95s will offer greater protection from the virus. As we have learned more about the virus and its methods of transmission, we now know that most transmission occurs because of breathing in airborne particles, and there's less concern about high-touch areas. In most cases, cleaning with soap and water will be effective and reduce the need to use disinfectants. Previously, the sharing of tools and equipment was discouraged or prohibited. This is now allowed once again.
We have reviewed some of the changes in these prevention measures, and it is important to know there is still a OSHA standard to protect workers from COVID-19, and that employers still need to take measures to protect workers. Employers must still evaluate how to maximize the ventilation system, bringing in outdoor air and using the best filters possible to refresh and clean the air. They may also add additional systems, such as portable HEPA filters as needed to clean indoor air. Employers must provide time, supplies, and access for frequent hand washing and provide hand sanitizer for use in between hand washing. Employers must have a protocol for regular cleaning and provide time and supplies for workers to carry out ongoing cleaning of frequently touched surfaces and objects. If disinfectants are used, such as to clean after a COVID case was at the work site, the employer must provide proper training on chemical safety and the right personal protective equipment.
Employers must provide effective training to workers, which should include the things on this list. In addition, worker training must now also include information on how the vaccine is effective at preventing COVID-19 and protecting against both transmission and serious illness or death. Also, training must include how to use respirators and the right to request face coverings or respirators at no cost and with no retaliation. Employers still need to have a symptom screening program, so workers who are ill or exposed stay home. They also need to have a plan to respond if there are COVID cases at work. If workers are exposed at work, employers must still notify workers in writing within 1 business day. And for limited literacy workers, they must also be notified orally or in other effective ways. They must still investigate which workers may have been exposed or are close contacts to a COVID case and take follow-up steps. The steps that they take to follow up will depend largely on workers' vaccination status. Until now, if workers were exposed or infected with COVID-19 on the job, in other words, they were a close contact of a case, employers had to follow these steps. All these steps are still required for workers who are unvaccinated.
If workers are fully vaccinated and are exposed at work, or if workers have had COVID-19 in the last 90 days, and the workers do not have any symptoms of COVID-19, then they do not need to be excluded from work or get tested for COVID-19. Only if they have symptoms would they be tested and excluded. Now we will do a quick summary of what we have covered in some of the key differences for vaccinated workers and unvaccinated workers. Vaccinated workers in most settings do not need to wear face coverings, but can do so if they wish to, and the employer must provide these upon request. Vaccinated workers do wear face coverings during outbreaks if they are indoors or outdoors and less than 6 feet apart. The employer provides N95 if there is a major outbreak at work. They also wear face coverings if there's an order from the California Department of Public Health or a local health department. If these workers are exposed at work, they do not need to be excluded or tested after an exposure unless they have symptoms. Unvaccinated workers continue to wear face coverings and are able to receive N95s upon request. They also wear face coverings during outbreaks, in addition to the indoors and in vehicles when they are outdoors if less than 6 feet apart, and N95s are provided. Again, with a health department order, that may also influence when unvaccinated workers have to wear face coverings. And if they are exposed at work, they are excluded for at least 10 days and they're offered testing. Finally, if any unvaccinated worker has symptoms of COVID-19, they are offered testing during paid time, regardless of whether there was a worksite exposure.
Employers must put all of this together in their written program that describes their policies and procedures in these areas. Workers have the right to know. Employers must provide training on COVID-19 and the steps they're taking to prevent infections. Let workers who are exposed at work know in writing, and provide a copy of their written plan to prevent COVID-19 to workers who request it. Also, workers have the right to take action for health and safety on the job. Some of the steps they can take are ask for information, report hazards or problems, bring up possible solutions, refuse work that could put their life in danger or cause serious illness or injury, join with other workers to speak to the employer about needed changes, and file a complaint with OSHA. It is illegal for an employer to retaliate in any way when workers speak up or take steps to address health and safety. In this short video, we provided highlights of the changes in OSHA's emergency temporary standards, so workers know what to expect. For more detailed information on the employer requirements and the OSHA standards, visit the following websites. There are frequently asked questions in English and Spanish, and more information on OSHA's COVID website. In addition, if your organization would like training from LOHP or have further questions, please contact us at the email listed. There is a website with outreach materials and resources in many languages, saferatwork.covid19.california.gov, which also may be useful. Thank you.